Hello everyone, welcome back to our channel. Those who have not subscribed to our channel, do subscribe now. Our channel is a complete anatomy channel. We have gross anatomy videos, histology, embryology, neuroanatomy. So do subscribe now, keep watching the videos. We will see in this session foot as a structural and functional unit. Do you know the human foot is aptly described as an architectural marvel? Its construction is the best example of the structural adaptation to the function. In our channel, we have already covered the introduction to lower limb and many lower limb videos, including the arches of the foot. You go through that videos also. And in this video, we will describe mainly the arches of the foot in relation to the function of the foot. The three learning objectives for the session are: before we start the learning objectives, what is the comparison of the ankle and foot complex in the upper limb? Yes, wrist and hand. But there is a distinct difference in the functions of wrist and hand and foot. Just think of your feet for a half minute. What is its role? Weight bearing stresses under a variety of surfaces and activities that maximize stability and mobility. So in this session we will see the bones of the foot and their relations, arches of the foot and structures supporting them, and to identify the bones of the foot on the radiograph. Why the foot is set at right angles to the body? Imagine you are standing. What is the function of the foot? Foot is the stable base for weight bearing. Imagine you start walking. Feet should act as a rigid lever for an effective push-off during gait. Imagine you start running, jumping. Now the foot has to dampen the rotations imposed by the proximal joints like hip and knee. It should be flexible enough to absorb the shock of the imposed body weight as the foot hits the ground. The foot should be adaptable to uneven terrains and surfaces. So there are many functions of the foot, and foot is structurally modified according to its functions. So for the first function of weight bearing, foot should be pliable enough to withstand the stresses. For its effective second function, it should be transformable into a segmented lever. So simple lever may help, but segmented lever will increase its efficiency. So the segmented foot, how it can distribute the body weight? It can distribute the body weight effectively if it is arched. So for its functions, the foot is segmented, the foot is arched. Segmented and arched foot for its two main functions of weight bearing and the segmented lever in walking, running and jumping. In this picture, weight distribution in the arched foot is given. For example, if you weigh 80 kg, then 40 kg of the body weight is distributed to each lower limb. This 40 is distributed from the lower limb to the foot Then it is equally distributed to the back 20 kg and to the front 20. This front is distributed among the metatarsal heads, including the two sesamoid bones in the first metatarsal. So, arched foot, there are two arches, longitudinal arch and transverse arches. Arched foot protects the nerves vessels in the sole of the foot. Now we will see elaborately the bones of the foot. Functionally, the foot is divided into tarsus, metatarsus and phalanges. 28 bones, including the two sesamoid bones in the tendons of flexor hallucis brevis. Now we will start with the tarsal bones. Type of the bones, they are short bones, 7 in number. If we compare these tarsal bones with the carpal bones are arranged in proximal and distal row. The tarsal bones are arranged in proximal, in distal and one intermediate row also. So what are the proximal tarsal bones? We will see now. One is calcaneus, 2 is the talus, 3 is the intermediate navicular, 4 is this cuboid, and 5 is this lateral cuneiform, intermediate cuneiform and medial cuneiform. Calcaneus forms the heel, we have to remember. When falling, the heel touches the ground, the calcaneus touches the ground. Talus is the link between the leg and the foot. Again, if you compare the upper limb, proximal row carpal bones all are articulating with the forearm bones. Here, tibia and fibula only articulate with talus. We can remember these tarsal bones by the mnemonic. The cab in New Mexico is Land Cruiser. T for talus, cab for calcaneus, New navicular Mexico, medial cuneiform is intermediate cuneiform, land is lateral cuneiform, cruiser is cuboid. Did you like this mnemonic? Now we will see few more details of the tarsal bones. So this pink marked tarsal bone is talus. In Latin it is meaning ankle. Its shape is interesting, is it? Can anyone try its shape resemblance to? It transmits the body weight from the leg to the foot. Its shape is resembling a small tortoise consisting of head, neck and body. Head articulates in front with the navicular bone and below with the sustentaculum tali of the calcaneus. Body upper surface articulates with tibia and fibula. Lower surface articulates with calcaneus. In short, talus articulates with 4 bones, tibia and fibula above, calcaneus below and navicular in front. Now we will see the calcaneus. So this is the calcaneus bone which forms the heel. The calcaneus in Latin meaning the heel. It is the largest of the tarsal bones situated below the talus and behind the talus. It has 6 surfaces, upper surface. This is the plantar surface which has the tubercles. Medial surface which has the projection called sustentaculum tali by which we can identify the side. And this is the anterior surface and this is the posterior surface which gives attachment to the Achilles tendon. So if this Achilles tendon pulls the calcaneus, it raises the heel, that is the plantar flexion. In front it articulates with what is this bone? Cuboid, calcaneo-cuboid joint, with talus and navicular talocalcaneo-navicular joint. So now the navicular intermediate tarsal bone. What is its shape? Navicular means boat shaped. So what are its articulations? You can suggest now. In front it articulates with three cuneiform bones. Behind it articulates with head of the talus. Medial surface as the navicular tuberosity. Lateral surface is articulating with the cuboid bone. Now the cuneiform bones, wedge shaped. In Latin it is wedge shaped. Distal surfaces of three cuneiforms articulate with, yes, metatarsal. First three metatarsals. Proximal surface of medial cuneiform, intermediate cuneiform and lateral cuneiform, it articulates with, what is this bone? Navicular. Now the last tarsal bone, cuboid. In Greek it is derived from the meaning of cubicle or six. It is exactly in the shape of the cubicle. It has distal surface, proximal surface articulates with calcaneus. This is the calcaneo-cuboid joint. Distal surface articulates with fourth and fifth metatarsals. Now we have completed the tarsal bones. Now the metatarsal bones. They are like same like metacarpal bones, miniature long bones. Having the distal end, they are called the heads of the metatarsals. Proximal are called as bases of metatarsals. And intermediate is the shaft. So in this we can appreciate first metatarsal is the thickest and stoutest, and second is the longest. Bases articulates with distal row of tarsal bones. Heads articulate with the proximal phalanges. Now phalanges are 14 miniature long bones, 2 in the great toe and 3 in the other toes. We have completed the tarsal bones, metatarsals and phalanges in detail. Now we will see the ligaments of the foot. There are many ligaments in the foot. In this we will see only the main ligaments, which are very much important to support the arches of the foot. On the medial side you try to observe, this is the medial side. That is the plantar calcaneo-navicular ligament, otherwise called as spring ligament. So this is, you just remember, this is medial side. This ligament is now going to support the medial arch. Now this is that another ligament on the lateral side. This is lateral side. This is long plantar ligament. Deep to that we have the short plantar ligaments on the lateral side. Now in this picture the students can appreciate, this is the plantar calcaneo-navicular ligament. You can otherwise called spring ligament, which supports this head of the talus. You just try to remember this ligament. We will see again in the arches of the foot. And these are the ligaments on the lateral side, long plantar and short plantar ligaments. So we have completed the bones of the foot. We will identify the bones of the foot in the radiograph, proximal to distal. These 1 and 2 represent the malleolus, medial and lateral. Then 3 to 10 represent the tarsal bones. We have to remember talus, navicular, cuneiform, calcaneus, cuboid. Then we have the metatarsal bones. You try to see 11 and 12. 11 and 12, they are the two sesamoid bones in the heads of the first metatarsal. 16th is the metatarsophalangeal joint. 17 to 19 phalanges. So we have seen the bones of the foot elaborately. Now it is the time to identify the bones of the foot. Can we identify the bones of the foot in this lateral radiograph of the ankle and foot? Yes, that is calcaneus. This is head of the talus. That is in between proximal row and distal row. That is intermediate. What is that? Navicular. This is on the lateral side which articulates with calcaneus. Yes, cuboid. Now this is the dorsal radiograph of the ankle and the foot. Yes, that first arrow represents the base of the first metatarsal bone. Second is the navicular. Yes, what are they? Intermediate cuneiform, medial cuneiforms. Yes, this is the very interesting bones in the heads of the first metatarsals. Yes, sesamoid bones. Yes, we have completed the bones of the foot and our objective of identifying the bones of the foot in the radiograph. Now we are moving to the interesting topic, arches of the foot. Do you know that human foot alone among the primates is having the foot normally arched in its skeletal basis with concavity towards the sole of the foot? Have you observed anyone the feet of the newborn and infants? Have you observed? They are flat. So do you think they are not present at birth? The arches of the foot are present from birth due to the presence of subcutaneous fat. The arching is not so apparent, still the child adapts to the normal gait. The bones of the foot are arranged in the form of longitudinal arches and transverse arches. Longitudinal arches, we have medial longitudinal arch and lateral longitudinal arch. Now we will start with the medial longitudinal arch. So these are the bones which form the medial longitudinal arch. How does it resemble? It resembles the big arc of a small circle. Medial longitudinal arch compared to lateral longitudinal arch, it is higher, more mobile and resilient than the lateral arch. So, what are the bones forming the arch from behind forward? Can anyone name it? Yes, this is calcaneus, talus, navicular, 3 cuneiform bones, medial 3 metatarsal up to their heads, including the 2 sesamoid bones. Each arch has following features. So any arch which will have one anterior pillar, posterior pillar, and it is the highest point or summit and which is most vulnerable, as if that part is broken, arch will collapse. So that is called keystone. First we will see the posterior pillar, that is the head medial tubercle of the calcaneus. Anterior pillar is the heads of the 3 metatarsals. Summit is what is the surface of talus, which forms the ankle joint. Trochlear, upper surface of the body of the talus. Now we will see this keystone. Keystone, you can compare it. This is the arch, stone arch. This is the highest keystone. If this stone is broken, arch is going to be affected. So this is the keystone in the medial longitudinal arch, which is the head of the talus, being received in front by the navicular bone and below by the sustentaculum tali, and in between by this spring ligament in between them. So this is the keystone of the medial longitudinal arch. We have some seen anterior pillar, posterior pillar, summit and keystone. Now same like the medial arch, we will see the lateral arch. It represents the small arc of a big circle and its summit is low. Rigidity is the characteristic because it is formed of less bones and less joints. We can even appreciate when we keep our feet on the ground, lateral arch comes in first for weight bearing than the medial arch, which can be appreciated by the footprint of the normal individuals. So what are the bones forming this arch from behind forwards? Calcaneus, cuboid and lateral two metatarsals up to their heads. It has anterior pillar, that is heads of 4th and 5th metatarsals, posterior pillar, and this is the summit. So this is the summit of medial arch, and subtalar joint is the summit of lateral arch. So summit of lateral arch is lower level than the summit of the medial arch. Keystone of this arch is, what is this joint? Calcaneo-cuboid joint. Now we can compare the bones forming the medial arch and lateral arch. So this side is medial arch, this side is lateral arch. You can see that calcaneus is shared by both longitudinal arches. We have completed the longitudinal arch. Now we will see the transverse arch, as each foot has two longitudinal arches but has half transverse arch. So this both feet are held close to each other, then we get a complete transverse arch. Transverse arch is made of distal row tarsal bones and the metatarsal bases. We have completed the features of the arches of the foot. Now we are going to see the supports, very interesting part of the arch of the foot. They are compared to the stone arch very interestingly. Keystone, it is the main support. Then if the arch is wide, we have to tie these two pillars. This is anterior pillar and this is posterior pillar. If you tie these two pillars, two ends, they are tie beams. Then if you tie the adjacent stones or bridge the adjacent stones with cement, then they are called as staples or tie beam. Now even we are thinking more protection and support for the arch. We can support the arch from above. We can support this arch from above by tying this arch to the above highest point. So that is called a sling. So in this phenomena, we will see the arches of the foot also. Interestingly, even though the foot is not static as the stone arch, we can compare for functional reasons. So what is the tie beam connecting the metatarsals and the calcaneus? What is this? Plantar aponeurosis. So that is the tie beam. Like in the small ages, we used to make a small bow with one thin stick and tie the thread in between the two ends. Like this is these two parts of the arches, anterior and posterior. Pillars of the longitudinal arches are tied together by the plantar aponeurosis. Medial part of the plantar aponeurosis for the medial arch, lateral part of the plantar aponeurosis for the lateral arch. This is the main support mainly in standing. Not only plantar aponeurosis, even whatever in this sole of the foot, muscles in the first layer, second layer, they also take origin from calcaneus and inserted to metatarsal. So they also tie both ends, both sides. So they also act as tie beams. So this is the first layer. It's an interesting cartoon. Two abductors. So they are going away. Abductor hallucis and abductor digiti minimi. In the middle we have a matchmaker, that is flexor digitorum brevis. So it's for fun cartoon. So first layer of the sole of the foot, medial side, medial longitudinal arch, and lateral side, lateral longitudinal arch. Now the second layer, then this cartoon is again very interesting. Lumbrical muscles. So second round, lady movement. Lumbrical muscles. Ladies are sitting on a rectangular table. So lumbricals and quadratus plantae. Two tendons, flexor hallucis and flexor digitorum longus. They also act as tie beams for the longitudinal arches. Third layer muscles. Two flexors on each side, flexor hallucis brevis, flexor digiti minimi brevis. When they bow, they get closer, so adductor hallucis in the middle. So these are the four layers of the sole of the foot represented in the cartoon. Fourth layer is our plantar and dorsal interossei. So we have seen the important structure, that is the tie beam. Now intersegmental ties. So tie beams tied the ends. Small bones are tied together, that is intersegmental ties. They are like staples. On the medial side, we have seen that important ligament is plantar calcaneonavicular ligament. On the lateral side, long plantar and short plantar ligaments. These ligaments are itself supported by these tendons in the fourth layer. Tibialis posterior supports the spring ligament on the medial side and peroneus longus on the lateral side. Then what are the slings and sustentacular? So the foot is should be tied to the above. So where can we tie? What is above the foot? Yes, leg bones. So the muscles arising from the leg bones, they come and forms the sling for the longitudinal arches. So if you see, this is the tibialis anterior muscle, which takes origin from the lateral surface of the shaft of the tibia attached to the dorsal surface of the first metatarsal bones. It holds the medial longitudinal arch above. So this is the sling for the medial longitudinal arch. For the lateral sustentacular action for the medial longitudinal arches, tibialis posterior, which arises from the back of the leg and inserted to the fourth layer, it holds this arch from below. So that is sustentacular. Sling for the lateral longitudinal arches is peroneus tertius and peroneus brevis. They arise from the medial and lateral surfaces of the shaft of the fibula. They are inserted to the dorsal surface of the fifth metatarsal. So we have to remember the muscles from the leg bones inserted to first metatarsal on the medial longitudinal arch, inserted to fifth metatarsal for the lateral longitudinal. They act as slings. Sustentacular on the lateral longitudinal arch is supported by, that is the peroneus longus. So now we have completed the supports of the longitudinal arches. Now we will see the supports of the transverse arches. So transverse arches, mainly the students should remember the metatarsal bones. So what are the muscles in between the metatarsal bones? Interossei muscles. They act as intersegmental ties, and also the adductor hallucis. Tie beams are peroneus longus and tibialis posterior. acting from above. In fact, slings of longitudinal arch support the lateral supports the transverse arch also. We have completed the interesting topic arches of the foot. Now we will see few important deformities of the foot. This is the normal arch and normal footprint. This is the flat foot or pes planus. The foot is longitudinal arch is mainly affected. So this is the footprint of the flat foot. This is the pes cavus and this arch is high. Have any of your friends or colleagues have flat foot? Do you think what is the main cause of flat foot or high arched foot? Try to find out. Another interesting deformity is club foot. So walking on the toes like horse, that is equinus. Walking on the calcaneus, then that is Talipes calcaneus. Talipes varus. So this is varus inverted and adducted, valgus everted and abducted. Combinations may occur. Talipes equinovarus is the commonest combination of the foot deformities. This is Hallux valgus. So we have completed the longitudinal arches, transverse arches and the supports of the arches in detail. So both longitudinal and transverse arches, now you can understand its structures. It is structurally designed for its two main functions which we started in the beginning of the session. So it's the time for multiple choice question. A 24-year-old male presents to the emergency room after a motorcycle accident. X-ray reveals a fracture of the bone of the right foot that articulates with tibia, fibula, calcaneus and navicular. Which bone of the right foot is fractured? So the tip for this question is the tarsal bone which articulates with tibia and fibula. Only tarsal bone. Yes, it is talus. A podiatrist evaluates a patient with severe flat feet. Upon physical examination, the patient's medial longitudinal arch is collapsed. Which of the following tendons is the most important tendon of the medial longitudinal arch? So main ligament is spring ligament and which is supported by main ligament or main tendon is tibialis posterior. A patient sustains a crush injury to the left foot leading to the damage of the primary structure supporting the lateral longitudinal arch. Which of the following ligament is critical to the stability of this arch? So it is lateral arch. Main ligament is long plantar ligament. I hope you should have understood this interesting topic. These are the references and acknowledgements. Thank you all. Those who have not subscribed to the channel, do subscribe now. Keep watching our videos.